Hi, Grazel. How are you doing today?
Good, Scott. It's nice to be here.
Yeah, nice to have you here. Um, Therapy is very vulnerable. Therapy is kind of the most vulnerable thing you can do in a sense. Um, do you ever find that people are scared to tell their therapists things inside them? And can you tell?
Yes, I think it's a natural process to not open up right away. I think it's really important for the clients to feel safe and they're going to be able to they're the expert in what feels safe for them. So it's totally okay if they don't share everything. And how can I tell? Some clients are direct and they'll say, I don't want to talk about that. And then I respect that, and then we talk about what makes it difficult to talk about a certain thing, even though we're not talking about it. And we can attend to the emotions that come with that. Um, as some folks may beat around the bush, and that's kind of how you can tell is that they'll probably change the subject or um, go on a tangent. And you kind of, I just follow them and see where they're at. If I feel that they're doing that because it doesn't feel safe, then I'll make it explicit and share that, hey, I'm noticing that I asked you a question and it may be a very sensitive question to answer. And I'm noticing that you're going away from the question. And I just want to attune if that question was too scary and I want to be able to attend to you if that was too much for you. Right. So I meet them where they're at. I don't go deeper into poking for them to open up. That's not to the best of their interest. But I work with the emotions that come up in the moment, whether it's nonverbal or directly expressed.
Yeah. Yeah, I mean, I guess in this scenario, maybe people don't know what's going to happen if they say something to a therapist. So are there any occasions where you legally have to break confidence? Because we know that therapist-client relationships are confidential, but there's got to be occasions where you have to tell someone else.
Yes, absolutely. Um, in the beginning of the work, it's really important to reiterate what they read in the informed consent form, which means that we are mandated reporters. So we have to report any harm or a potential harm that will be caused to the protected classes, which are elders,
Mhm.
children, and dependent adults.
Okay.
So anything that, let's say, when I meet with you, for example, if you're my client, I would tell you, hey, Scott, just so you know, right, before you share anything to me, I need you to remember that I'm a mandated reporter, that even if you're sharing about a friend taking care of an elder, and if I hear that there's harm being done to that
Mhm.
person, I'm gonna have to assess what kind of harm is done because it's important for me to protect the public. And those are the protected classes, and I'll have to break your confidentiality. So I remind my clients that that's important for them to know. Sometimes they forget, right? And sometimes when they forget and they report something and they share something and they don't remember that it might be something reportable, it could create a rupture in our work together. But a rupture, in therapy is the only place that you are able to really create repair when there's rupture. So, but it's really important that we abide by our duty to protect
Yeah.
the patient or those people that are protected. They're supposed to be protected.
Yeah. If someone admits to breaking the law, do you have to report that legally?
No, not specifically. It has to be a harm to those protected classes, which if they reported harm to self or others,
Hmm.
we either have to report it to the police or we have to actually report it to the police and report it to the identifiable victim that will be potentially targeted,
Hmm.
right? So it's called Tarasoff. So if they want to look into that, they can research Tarasoff, and that's how they will know that we will report harm to a potential victim.
Okay. Yeah, because over here I know in the UK therapists their kind of duty of care. It's not just to protected classes as such. It's if someone admits to breaking the law in a particular way and it's affected anyone, or if they say I'm thinking of planting a bomb at this place, they have a duty to report that, even if it's not targeting a particular group of people. Um,
Yes.
that sort of thing applies to you as well.
Absolutely. A duty of care, duty to warn, all right, are something that we have to assess for every time. So yeah, in particular, if someone is saying like, I'm planting a bomb here, that's, you know, that's a reportable crime.
Okay,
Yes,
that makes
yes, yes.
sense.
Uh-huh. But like, for example, let's say you're a client and you're having suicidal thoughts.
Mhm.
You you can share that. That's people actually have suicidal thoughts most of the time. It's quite natural for people to feel helpless and they want to be done with their life, right? So long as there's no plan or intent, then it's okay to share. But once you have an imminent threat to your own safety and others, then we have to make sure that you're protected.
Yeah, yeah, no, that makes sense. So, let's take a scenario, maybe not as extreme as planting a bomb, but how do you respond when a client admits something they haven't told anyone before, and maybe it's something that makes you internally a little bit uncomfortable? How do you manage that?
I mean, that's what therapy is about. You tell us, things you haven't told anyone before, and that's okay. If it does feel uncomfortable for me as a therapist, that's what we call countertransference. We have our own support where we consult with other therapists, without breaking confidentiality, of course, and we process our own feelings about something that is uncomfortable for us that the patient brought in, right? So that it does include in our work with the patient. We also have our own individual therapists that we can share again without breaking confidentiality and look at what's going on for the therapist. It's the self of the therapist creating a space where it's affecting the treatment. And if so, then we need to work on that. And that's an important part of our work is that in order to create safety for the clients, we have to make sure that our personal biases is not coming in the way of treatment.
Yeah,
So, with that said, if a therapist is not, if you're feeling that the therapist that you're working on is showing a lot of countertransference or personal biases,
mm,
I think it's important for you to leave and go find another therapist right away, especially if they're not working on it.
yeah, okay,
Yeah.
yeah. I mean, that's possibly something that a lot of people don't realize. Like your therapist is in therapy themselves.
Yes, they're supposed to.
Yeah. Because when you're dealing with such heavy things that your clients are bringing to you, you need that other person to help you with your own processing. And it sounds like
Yes.
that you really take to heart and like focus on in your own inner world.
Yes, I think for people, it's really important. You should ask if your therapist is in their own individual therapy because we can only take you deeper in your work as deep as we've gone. Yeah.
That makes sense. And maybe just the last question, just quickly. If you're the client sitting in the room and you feel like you want to say something, this happens to me quite frequently. You feel like you want to say something and you just can't seem to get the words out because there's fear in the way, or you're expecting judgment or anything. What can the client do to kind of cue the therapist that there's something going on?
They can, I mean, as therapists, again, we're trained to look at nonverbal cues to be able to attend to the needs of the client. So if I was the client and I'm having a hard time sharing what's going on for me, um, I would encourage you to share that you're not able to find the words
Mm,
to speak about your experience. and that you need help to do that, right? But again, sharing something like that is vulnerable, and some people don't know how to ask for what they need. So at the same time, Scott, I'm going to say, don't put too much pressure on you. If you feel like you can't find the words to express your feelings and your experiences, all you have to do is let the therapist know, hey, I'm having a hard time.
Yeah.
And the right therapist is supposed to guide you in finding the words that work for you and being there with you and joining you and meeting you where you're at and not pushing you to your limit.
Yeah. No, that's great. Yeah, really solid advice. Thank you. Um, yeah, we'll speak to you again very soon, I'm sure. Hope you have a great day.
Okay, you too, Scott. Thank you.